Welcome back. Coronavirus cases are spiking across the U.S. and children are a big factor for the recent increase. In fact, 61,000 new cases involving children were reported during the last week of October. This is more child COVID-19 cases than any previous single week of the pandemic. So I want to bring in Dr. Jen Caudle, physician, associate professor at Rowan University. Good morning to you.
Good morning.
So let's talk about this spike, because you can't just say, oh, it's because the kids are back in school, because they've been back in school for a while now in some cases.
Yeah, they have. You know, this is actually part of the larger spike that we're seeing in the whole nation. You mentioned that we had 61,000 new cases of pediatric COVID diagnosed in the last week of October. Just to put that into context, throughout the whole pandemic, we had about a little over 853,000 cases of COVID in kids. 200,000 of those occurred in the month of October, 61,000 in that last week of October, as you mentioned. What we're seeing is an uptick in cases in kids, but that reflects the rest of the country, Alex. We're seeing an uptick in the entire country. On Thursday of this week, we had 121,000 new cases of COVID in general on that one day. So what we're seeing is there are more cases everywhere, kids included.
And of course, the conversation has been, especially in Philly, about, hey, is it time to bring the kids back into the classroom? So certainly this is going to have an effect on those conversations.
Absolutely. I mean, it has an effect on really every conversation. And what it does is it reminds us that kids are a part of this equation too. As we talk about the large numbers, like, for example, the 121 cases we saw on Thursday alone, we have to remember that a sizable number of those are kids. And one of the reasons maybe is that, you know, kids we know sometimes don't have as severe of symptoms. They may have mild or no symptoms. They may be less likely in some situations to even get tested. And those two facts in general actually could lead us to even be undercounting the number of kids who had COVID. We may not even know really the full number. But Alex, is it going to affect the conversation we have about everything? Yes. I mean, this is changing the conversation we're having going into the wintertime and holidays and things like that. With all the cases rising, we have to be talking about this on all levels.
Well, you mentioned that too, that sometimes people don't get their kids tested as much as they would, say, adults. So if kids do get COVID-19, are they experiencing the same symptoms typically that we've been talking about with adults?
Yeah, so that's a great question. And sometimes it's simply that we may not even know that a child has COVID, or their parents are not able to actually get their kids tested. So the symptoms tend to be milder in kids. We do know that. But we also know that kids can also have severe symptoms and severe sequela. Remember the multi-system inflammatory syndrome in children? We've talked about that a number of times. That's that severe sort of syndrome that can occur in kids after they've been infected with COVID. That still does occur, but far less. You know, kids have either mild or no symptoms at all. That's a good thing, but what it means is we just may not know all the kids who have COVID. So once again, it brings us back to, you know, people are probably saying, so what do we do about all this? What we have to focus on is that those things we've been focusing on and trying to focus on all along. That's the hand washing. Wearing masks is so important. Social distancing, staying out of crowds. It applies for kids just like it does for adults as well.
And so is that the key here to keep this from continuing to go up, is making sure we're following all the rules that have been established?
We have to. We absolutely have no choice. And really, it's our best it's our best chance at sort of pulling ourselves out of this as much as we possibly can, especially coming into this winter season where we know people are going to be congregating more inside, right? Because it's cold. So people are probably going to be spending less time outside. And we know that outside is better for reducing spread of COVID, et cetera. Inside is typically worse. So there are all these variables going into the winter. We have to wear our masks. We have to social distance, stay out of crowds and all of that. It's a huge reminder for that.
It certainly is. Well, thank you, Dr. Jen Caudle, for joining us and explaining this uptick that we're seeing.
Yeah, thank you.